So there's also face shields that look kind of neat that people can choose to wear if they really want to get into it, right? So I think the key thing is use what you have. Don't spend an irrational amount of money on apocalypse supplies, right? Get something that's sensible and that works for you and that you're going to wear. So if you are not going to wear a face shield like that, and if you know yourself that you're just not going to do it, don't do it. If you can manage by wearing a mask, okay, wear a mask. That's what the recommendation is right now.
So the mask is the key thing for the eyes. So the contamination still can happen through the eyes?
It's unclear, really. So what we know is it's droplet, respiratory aerosolized if you do have an aerosol that's being generated. And there's also some, with touching your face and with fecal oral transmission. I mean, there's been a number of ways that people have calculated that this has been transmitted. That being said, if you do have COVID particles on your hands and you then touch your face, yes, you could catch COVID. It's through mucous membrane transmission of your eyes being one, sure. If somebody got, coughed directly in your face and go into your eye, it's possible. I mean, it hasn't been described, but certainly I wouldn't say it's out of the realm of something that could happen, but it's not really something that we describe as much. Are you guys there?
So is it better? It is better to wear the glasses.
I would say so. I mean, if you have glasses available, I would wear them. Are you guys there?
Yes, we're here.
Yeah.
Yes. So is it better? It is better to wear the glasses.
I would say so. I mean, do you have glasses available?
So, and I wanted to ask you how your daily life changed, like at home as well for you, not only at work.
So, I mean, at home for me, I'd say it's a lot more quiet, as it were. So practically, I was thinking this morning, things that I miss. I miss, going to my regular exercise classes. I used to go to CrossFit quite often. I used to go to cycling classes, Soul Cycle, things like this, rock climbing. I used to meet friends for, brunch, things that we all like to do. There was a hot yoga class I used to go to, and I remember I really liked that you could smell all the eucalyptus, and it was really nice. And now you're thinking, oh God, what's in the eucalyptus? Can I smell that? And it's this droplets that can kind of get misted out. So I think a lot of things that we used to do and really take for granted are being missed. I was actually at the grocery store today. I was picking up, some food. And I remember that when I'm in the grocery store, I always like to go to the little cafe there and get either coffee or tea or something like this. And we can't do that anymore. It's not available anymore. So for me, I mean, that's what I noticed most. I mean, the other thing is I think I'm getting a lot more into home decor than I previously was. I have ordered paint. I have not yet painted, but I've ordered it. So doing things that aren't really things that we usually do. And I think the important thing here is finding new activities that you enjoy while we're in this hopefully temporary state where you can say, hey, look, what I've done is I've painted my room, or I've, done something to really make myself feel better in the home. Right. So that's important for everybody, I think.
And are there things at home that you're doing that you weren't doing before, that you're dedicating more time, like new skills, or something to entertain yourself?
So working out at home is something that I never really did as much in my apartment. I recently ordered a Peloton and then realized that it got delayed delivery until June. So I don't have the Peloton, but I've been doing Pilates at home. I've actually set up half of my room as a little bit of a yoga studio. So, really just sort of doing things in the home that I would have done outside the home and finding a way to bring that to sort of make me feel better while I'm in my home. I've also been doing more art. I used to paint quite a lot, and I've gotten back into that.
Nice.
A lot of hikes, nature walks, because that's also okay. As long as you're social distancing, it's okay to go somewhere that's a remote location in a park, for example. So no, not everyone should go to the, if in New York, we have these pictures of Brooklyn Bridge Park where it's like everybody's there. No, that's not a good idea. But practically it's okay to go to a wilderness hike where there's maybe one or two people that you can see about 30 feet away. That's fine.
So to keep the distance, and we were also making this comment that would be better to call it physical distancing and not social
Correct.
distancing, because
Correct.
we need to keep being social and connected with people.
Correct. We do want to be keeping social and connected. Certainly, talking to our friends on FaceTime and things like this. I mean, I can think of maybe one time in the past several years where we've all had a joint FaceTime chat, and now it's something that happens almost every day. I talked to one of my best friends and her mom on FaceTime last night. I'll talk to, we have Zoom meetings and we have Zoom happy hours on FaceTime even.
Nice.
That's always really nice.
And I wanted to ask you the situation also at the hospital where you work. What mainly changed for you in your daily routine from going to work before COVID-19 and now that you have patients there that are affected by COVID-19, all the precautions that you are taking when you go to work?
Well, I think the key thing for me and for a lot of other surgeons are we're not doing elective cases anymore. So defining what an elective case is a little bit challenging. So for example, I'm a spine surgeon. Usually I would be dealing with people who have either tightness in their spinal cord, or in their nerve roots, which is an emergency in some cases. But in some cases, you're just uncomfortable, which is really unfortunate, but it's a risk-benefit ratio, right? So if somebody's in their 80s and they're otherwise sick, no, now we're not bringing them into the hospital because there's too high a risk. So right now, there's global cancellations of elective surgeries across the United States. So if you need a knee replacement, a hip replacement, certainly any cosmetic surgeries, breast reconstructions for cancer patients, things like this, these are being canceled. We're still doing cancer surgeries. We're still doing trauma surgery. So if someone comes in, they've been in a car accident or shot, we're still helping those patients, obviously. But how we deal with those patients after the fact has changed. So I actually had a patient who recently, obviously can't disclose identity or anything like this, went to the news, and she and her family had commented on they were really happy that they at least had been given the FaceTime opportunity. But it's very difficult for families to not have the ability to hug their loved ones when they're in hospital or to visit their loved ones when they're in hospital. So we're being a lot more virtually oriented in our patient care, one might say.
So even for the people that are not COVID affected, but they're at the hospital for other reasons, they're not allowed to be visited by their family, correct?
Correct, because a lot of people who are young and healthy are asymptomatic carriers. So you could have a very well-meaning brother or sister who comes in, they feel fine, they have COVID, and there you are.
So unless it's an emergency, you're not doing any other surgery, right? And then for the COVID-19 patients, what's the most challenging thing for you?
I think for me, the most challenging thing is getting them the orthopedic care that they need. So I have a patient who has had COVID for a month and he's been admitted elsewhere, and I need to see him in follow-up. So before, if he didn't have COVID, you would, call and they would come into clinic and you would see that patient and deal with their orthopedic issues. Or, any other, family doctors would go in and talk to people about their fertility or, their diabetes or anything like this, right? If you can't assess that patient in person and you really need to, it becomes a really big process. The patient comes in, they're isolated, they have to be assessed by the COVID team. You put on personal protective equipment, you see that patient at that point, you're going to be isolated likely for the rest of the day, or you need to kind of wash up, before you interact with any other patients. So it becomes a way more onerous process, both for the patient and the provider, to provide medical care that was easy in the past.
Also wanted to ask your daily routine when going to work, how you prepare from home to stay safe, and from when you go to work and when you go back.
Sure. So what I do is I have at least 3 sets of clothing that I change into on a daily basis. So I have a pile of clean scrubs in my office, that I keep there, that I've gotten from the hospital laundry. So essentially what I do is I come to work usually in scrubs at this point because they're clean and they're ones that I have washed at home and things like this. Because I don't want to wear my clothes that are at home. Right. So usually I would wear regular pants and a regular shirt to work, but practically I don't want to do that anymore. So I also usually would either cycle to work or take the subway to work. I no longer do that. One of my older colleagues who's currently doing telemedicine visits has very graciously loaned me his car. So I'm using this vehicle, with my own car insurance and things like this. And I'm driving to work now. I'll park, I'll get out of the vehicle, I'll walk into the hospital. At this point, they scan you, make sure you haven't got a fever, and they'll provide you with a new mask. Okay, not a new N95 mask, just a regular, mask that you would wear in the operating room. You go to your office, you take off the clothing that you came in with, okay, which will then go to the laundry. So I put that in a laundry bin, okay, once I get to the operating room, and I'll change into new hospital scrubs. At that point, I will, wear a mask all day and a surgical hat all day, see patients, do whatever I need to do. And then I'll change out of those scrubs into new scrubs that I then get, and then go home, take those off the door, throw those in the washing machine, which is luckily right next to my door, wash them, and then the day kind of starts again. So really, I'm going through 3 sets of clothing a day just to kind of minimize the amount of time that, and the risk of me bringing back COVID to my apartment. Now, I have 2 cats at home, so COVID can be transmitted to cats. So really, that's my main concern for bringing things home. The other thing is shoes. So I'm also leaving the shoes that I wear at the hospital outside my door. I'm not bringing them into the apartment.
So, and these are a procedure that we recommend also for people at home. Like, what do you recommend?
So if you're able to leave your shoes outside your apartment door or your house, that's great. Or as long as you're keeping them in a very select area within your house. I mean, I wouldn't wear shoes out to your bedroom or anything like this. I would say take them off either outside the door or at the door. If you have pets, keeping them secluded from your pets is a great idea. I think if you don't have pets, you can leave your shoes inside right at the doorway. That's perfectly fine. The difficulty is your pets will go to your shoes. So, yeah, I mean, if you have somewhere where you can kind of keep them in a box maybe, or in like a bin that's kind of secluded from your pets, that's probably the best idea.
And then for people that, share a small area with their roommates, and they have shared areas in the house, like the bathroom or the kitchen, what do you recommend for them to do to stay safe?
So really the key thing again, and it seems a little bit like a broken record that I keep saying this, is hand hygiene and making sure that you are being safe and, covering your mouth. So if you're somebody who has a cough, you should be secluding yourself from the remainder of your family. Okay. So part of this also tunes into, okay, if everybody's living at home and everybody's healthy and you're not coughing and you're sharing a space, sure, it's reasonable not to wear a face covering in your own home because those are the people that you live with. Okay. Let's just say you have a family member who is sick and who is coughing. Secluding yourself as that family member to your room, okay, and keeping isolated from the rest of your family is a good idea. At that point, everyone probably should be wearing face coverings in the home, especially the person who's sick. Frequent check-ins with your family doctor, your primary care provider, to make sure that you're doing okay. Calling them, they're available for telemedicine most of the time, or at least most of the providers at Temple are. Not going out. So if you're sick and you have a cough and you have tested COVID positive, you should be isolating yourself. You should not be going outside because you run a very high risk of contaminating other people, right? So for people who are known to have COVID or who are symptomatic, wearing a mask to the grocery store doesn't do it. You should stay in. You should not go outside. You should not be around the rest of your family.
But what about, so if they have symptoms, what's the thing that you recommend to do? Like they stay at home and call their doctor?
So if you have symptoms, you can stay at home and call your doctor, okay? Cover your face, use a face covering. Advise your family members to also use face coverings. Hand hygiene, okay? Wash your hands, don't touch your face, don't touch everything else. Lysol things down after you've used them or before you use them, okay? They have mobile testing units that are available to a lot of people. Now, again, it varies state by state and vicinity by vicinity. We had one at Jefferson Health, and we had a couple of mobile units at Temple. The Laratro Center, I believe, also did have it at some point, mobile testing, but it changes from day to day, just given test availability. Where you can drive through, you stay in your vehicle, you'll check in with a nurse, you bring a state ID, and then they'll scan you and they'll test you. It becomes a little challenging. Let's just say you're somebody who doesn't have official documentation or who doesn't have state ID. Getting testing is a little bit more of a challenge, but certain vicinities who have a lot of people who aren't documented, for example, and who do need testing will have some workarounds for this.
And we were talking about, when you share an area in the house, about surfaces and how to keep them clean. And then you were saying that there are different, if the virus is on a surface, it lasts for different hours.
Correct.
According to the material. Can you share that with us, please?
Yeah. So this changes day to day. Cardboard lasts 24 hours. Really for ceramics, metals, glasses, basically everything else that you could think of, generally it's 5 to 7 days is what they've tested that the virus can last. Now, granted, this is with ideal conditions. So if you wash your clothing with Tide, this is unlikely for your, for the virus to survive a wash cycle with hot water, right? I haven't seen any studies coming out of the CDC or any peer-reviewed articles that comment on that, but washing your clothes and washing your hands seem to work quite well. But left unfettered, the virus will last for 24 to 48 hours on cardboard, so your Amazon delivery boxes, and for 5 to 7 days on other surfaces.
Here we go. We have a question.
We have a question that's
Great.
from the audience, live questions from people.
Perfect.
So
1 second.
1 second, because they just arrived live from a live.
This is a
people
question
watching.
from New York.
It's a question from New York.
Sure. Hello.
1 second.
1 second. We're
Okay.
Here we go.
Hello. Can you hear?
Hello?
Hi.
Yeah. Hello?
Hi.
Can
Yes.
you hear me?
Yes, we can hear you.
We can hear you.
Hi, how are you, doctor?
I'm well. How are you?
Yes, I wanted to ask, I work with the Live Hope in the Listen and Give area, and I wanted to ask you with regard to COVID-19, we're hearing so many stories from so many different places. Do you really feel that heat, like direct sunlight or heat, can actually stop, kill the virus off? And then I have one other question for that after that.
So it depends on the level of heat, obviously, right? So warming something up, or I think what people have been talking about is the UV light, or just when the temperature gets warmer, are we going to see this virus becoming seasonal? So it's certainly possible, but keeping your temperature higher in your apartment, for example, wouldn't do anything for the virus. So when people are going to be stable, meaning that a person would not be hurt by that temperature, the virus will likely not be hurt, right? So unless you're going to heat yourself to a level that's unhealthy or unsafe, it won't do anything to the virus. Now, we are also using UV sterilization in some hospitals. So for example, to re-sterilize N95 masks, Abington Jefferson Health, for example, is putting the masks in a room, spraying them down, and then turning on a UV light for a certain period of time. Sure, that works. So if you have a UV sterilizer in your home, that could help, but it's not necessarily going to kill all the virus particles. So there is some evidence for that, but it's not the only evidence that's available. And certainly, washing your clothes in hot water is a great idea. Washing yourself in very hot water may not be, we want to just be sensible hand hygiene.
Yes, she's listening to you. Go ahead.
And there's another question,
yeah,
right?
Sure.
Yes, I didn't hear the other question. I didn't hear the other thing. And also, the other question I'd like to know, doctor, is do you feel that there is something that's being said that if you have heated liquids going down into your system every 30 minutes, that will push the virus down into your stomach acid?
So there's no evidence for that. Certainly, there's a couple of risks to that happening. It depends on the volume of heated liquids you're drinking, but that can actually be quite unsafe. People can get water toxicity, so I wouldn't overdo it. Certainly, if you feel ill, having a cup of tea is always nice, but it won't actually do anything to the virus. So again, liquids within the range that are safe for human consumption will not kill the virus. And certainly if it hits your stomach acid, you've already been exposed to that virus. You can absorb things through your oral mucosa, you can absorb things through your lungs. And hitting the stomach acid, it's not just one particle of virus, right? If you've been hit with the virus, there's going to be likely either respiratory exposure to that's not going to be affected by your stomach, and also oral mucosa could also absorb it. So once it's getting to your stomach, it's not really doing much. The virus doesn't just live in one location.
Is there any other questions that you would like to ask?
Yes.
Sure.
I'd like to find out from you, what do you think are the best ways for people to stay healthy during this time in terms of when they're in home with their family members?
Sure.
3 or 4 family members in the home.
Sure. So I think there's a lot that goes into health. I think the key thing is just maintaining healthy diet, routine as much as you can, and that includes sleep hygiene and sleep routine. The healthier you are from an overall immune system perspective, the better you're going to be able to fight the virus if you contract it, right? So firstly, it's just making sure that you're doing as much as you can for your health, healthy diet, being as active as you can within the home. That might be, working out with your family, skipping rope, just kind of whatever you can do, right? The other thing is making sure that you're minimizing your outside exposures. And if you are, you're using proper hand hygiene and you're using a face covering when you're out in public. Certainly also avoiding crowded spaces, counseling your family members to also avoid those crowded spaces and to use the same techniques. Amazon ordering is something that comes up a lot as a question. So people will get a lot of Amazon deliveries with the cardboard boxes. The boxes could be a potential mode of transmission. You don't really know where they've been. So I'm advocating for myself and for my family and for patients as well to open the boxes if you can outside your home, go and wash your hands, and then take those deliveries out of the box and then bring those into your apartment while leaving the cardboard outside. Cleaning down containers when you go grocery shopping is also a great idea. Dr. Sanjay Gupta actually has a great video where he's used his kids' craft glitter to kind of show how things can spread, because glitter gets everywhere, so does COVID-19. Taking them, wiping them down with either an alcohol-based solution or a bleach-based solution, not both. You don't want to mix those things. And then setting them on a dirty or a clean side of the counter. So you're just being really mindful of where your products have been and where you're placing them within your home. The key thing is don't touch your face, hand hygiene and face coverings in public, and keeping in contact with people through either, groups that you're involved in virtually, spiritual groups, talking to your family members by phone, and just trying to keep as well as you can in this time emotionally as well. Does that help?
Theresa, we have another question.
Okay, great.
Go ahead.
Hey, thank you so much for all the information that you're sharing.
You're absolutely welcome. Hi.
I'm the Director of International Children's Funds, and our question is about the children and what's happening with them.
Yeah.
Internationally, really. What advice do you have for the parents that are at home with their children right now who are trying to explain to them what's going on and any kind of precautions and how we should kind of frame that to talk to them? How do you move forward?
I can imagine it's such a challenge with kids. Yeah. So I assume you're a parent or somebody who does have children. So thank you for being supportive of children. It's tough. It's really hard to explain to kids why you can't go out and play with your friends and why school has been canceled. But what I've seen from actually friends of mine who have children, how they're explaining it best to their kids and say they're actually using it as a learning experience and saying, look, this is a way that we can stop transmission of this virus that could really hurt a lot of people by staying inside. And the things that are important that actually are really good life skills for kids to learn are going to be things, the hand hygiene, caring about your friends and neighbors. So just because, you might be feeling sick, you don't want to get them sick. Being social through the phone or through social media, appropriate social media posting and things like this. Those are all really useful things for kids to learn. And as we are in the digital age, as we enter the digital age, it's also a really useful life skill for children to learn how to learn virtually and learn through virtual Zoom classrooms and things like this, because I suspect in the next 20 years, that's going to be a really important life skill. So it's a little bit futuristic, but how I've had people phrase it to their children is, look, this is a little bit of a futuristic classroom trial. We're probably going to go back to the real classroom soon, but this is something that is a really important skill that you have to learn as well. People are also keeping busy with their kids in the home with different arts and crafts that they're doing, or even home improvements and things like this, and kind of try and make it fun. Like I had a friend whose kid painted their entire room So that's kind of interesting, but you can also take advantage, especially in New York, a lot of museums will have virtual tours. So as a parent, if you're doing homeschooling with your child, can also, take your kid on some virtual museum tours that are free. And that's really great for kids. Asking your kids to maybe do videos or TikToks or things like that, where they're educating other kids or sharing their creativity with other kids, and really trying to make it as fun for them as possible. I know it's hard thinking of this being fun in any way, shape, or form, but children can really be quite resilient and can really lean into it. And I think it'll also help build some good resiliency and lifestyle coping skills and things like this in the future. But certainly it's a challenge, and it's hard explaining to very young children why their routines have changed. But keeping it as normal as possible, I think, is the most important thing.
Thank you, Theresa. Do we have any other question?
Yes, we do. There's a question coming in from Boston.
There's a question coming in from Boston.
Sure.
It says
exometers, or I don't know how to pronounce that. Exometers that measures the amount of oxygen in the blood. Home testing.
So the home testing
of the home testing for oxygen, sure.
Can that verify COVID-19?
Verify COVID-19.
Oxygen levels are being low.
So it's not by itself. So basically, I think what they're talking about is the home pulse oximeter.
Yes.
Yeah.
Yes. That.
So that doesn't. So the only thing that verifies COVID-19 is actually a very complex clinical diagnosis. And Dr. Kreiner at Temple Hospital, who's one of the respirologists that we get a lot of our guidance from and we work with, sometimes people who have COVID can test negative, can have normal oxygen levels, and who may just have other symptoms that they present with. Certainly the most consistent thing that patients with COVID are presenting with is fever and respiratory symptoms. And a lot of times the respiratory symptoms will be part and parcel with the decrease in your oxygen levels. Normal oxygenation levels are anywhere above 95. Below 95, into the 90s and the 80s and into the 70s, that becomes quite dangerous. So certainly if you are taking a home pulse oximeter and your oxygen levels seem to be dropping, this would be a reason to call your family healthcare provider and talk to them about it. Or certainly if it's very low consistently, even considering going to an emergency department if you feel that you can't breathe. That being said, it's not going to diagnose COVID as of itself, right? So you want to take your temperature. You might want to take the home pulse oximeter if you have that available. And the key thing is making sure that you're communicating with your own healthcare provider to make sure that you're making the appropriate choices, whether or not you should stay at home, whether or not you should go to the hospital. But by itself, it won't diagnose COVID, but it could be an indicator that you have a problem with your respiratory function.
Thank you, Theresa. We also have another question.
Sure.
Okay, hold on.
So we're gonna put you on the screen.
You're okay, doctor.
Hi.
Hi. From Puerto Rico, calling here, blessings to everyone. The question is for the doctor is what is her advice for the people they already have skincare problems with this constant using of the hand sanitizer and all these disinfectant products? What these people should do about it? Because we have been seeing increase in people having skincare problems more now.
Right.
With all this alcohol using every day. So what is your advice?
So that is an excellent question. And we as healthcare providers often face that because we do need to wash our hands, obviously, before and after every patient contact. Key things to be involved is you want to maintain your skin barrier as well as you can. So alcohol-based hand sanitizers are great, but they're not for everybody. So oftentimes soap and water may be easier on the hands than just alcohol-based hand sanitizer all the time. The key thing is as well, using either latex or non-latex based gloves may be useful for you. So if you're using a glove, that does not mean that your hand is clean. That means that your hand is protected. So if you need to go and do something outside, for example, you could put on gloves, do whatever you need to do, not touch your face with those gloves, and then take off the gloves and do normal hand hygiene with soap and water. Moisturizing your hands with a very good healthcare grade hand moisturizer is often recommended as well. So people will use things like Aveeno. People will use like a hyaluronic based hand moisturizer, shea butter, cocoa butter, coconut butter, anything like that. That really does get into the hands and moisturize it. So look up medical grade hand sanitizers. You can get those things on Amazon or at your local pharmacy, and making sure that you're moisturizing as well as washing your hands. If it's getting really severe and if you're having skin breakdown, you may also want to consult a dermatologist. They are still a lot of times doing telehealth consultations as well, or your family health provider. It could be that you may have a diagnosis of psoriasis or eczema or something like this, and you may need a medical grade cream. But certainly a lot of healthcare providers also have that problem, nurses, doctors, people who need to wash their hands, and there are very good hand creams available to stop that from happening.
Okay.
Fantastic.
Thank you.
You're welcome. Stay safe.
That was very helpful. And I want to remind everyone watching, they can write comments or call the number 310-893-3404 to ask questions to Dr. Theresa. She's live from New York, and she's kindly with us here to share with us her experience working as a frontline healthcare worker, but also to give advice on how we can take care of ourselves. For example, Theresa, we were saying how the use of the mask is important to be used outside, correct?
Correct, yes. So masks are something that we get a lot of questions about by our patients in clinic, by our friends and things like this. So I do want to highlight a couple of different things. So this is an example of a mask I wear to work. So it's clean. It's my mask I'm going to be wearing this upcoming week. And you can see, I'll hold up the screen. It's an N95 mask, okay? This is what has been really in shortage. And this is something that oftentimes as healthcare providers we reuse. But the seal is really important. And essentially when you look inside of the mask, you can see that it's got a very good seal to your face that will prevent the particles from going in, okay? This is what I wear in the hospital if I'm around patients or if I'm operating, and that's our new protocol. Not necessarily one per patient, usually more one per day, one every couple of days, covered by another surgical mask. Okay. Item 2, this is the mask I wear at the grocery store, okay? It's different. You can see that it's not a surgical grade mask. It's actually something that my friend Edison Cortez, who's LA based, has actually made and sent to me. And I know Planet Glaze also has masks that are available if people don't have them. But it's a different mask. So the key thing is that you're covering your face, not just to protect yourself. The N95 mask both protects yourself and others. It stops almost 100% of the virus particles coming through. This mask is more to protect others. It's to keep you from aerosolizing or from droplet transmitting any COVID-19 particles that you may have should you be infected or anything else that you're infected with. There have been studies that have shown if you have COVID asymptomatically and you're walking around, if you're wearing a mask, you decrease the transmission to people around you by approximately 70%. If you're wearing a mask and your friend who you're 6 feet away from is also wearing a mask, that transmission rate drops to approximately 1.5%. And that's just one study. There's going to be a lot of variability in the studies taken. But wearing the mask is more important to stop you from giving your germs to everybody else than it is to stop you from getting them, unless you're wearing an N95 mask. So I think Sara has just
wanted to share that people can stay safe, and we're helping raising money to help doctors and nurses to receive the necessary protective gear. And when they donate, they will receive a mask, a protective mask that has a pocket where they can insert also a filter to protect themselves. Right. So it's very important that not always we are helping the doctors and the nurses to receive the necessary protective gear, but also they will receive one. So correct. You say that the N95 is better to leave it for the healthcare workers. Correct. They can donate and buy masks from Planet Glaze, or like make sure that they protect themselves when they go grocery shopping.
Correct. So the N95 masks, the key thing I want to talk about with the N95s is, yes, they're best reserved for healthcare workers. That being said, if you have a very legitimate reason, so if you're young and healthy and walking around, sure, you could still get COVID. You could still become very sick from COVID. So this is not to minimize anyone's health. But if you're a cancer patient, if you are somebody who has severe COPD, firstly, you should probably be staying home. But let's just say you need to go to the hospital for treatment. It is completely reasonable for somebody like that, if you have access to these, to wear one. Okay, that's not considered wasting it. That's considered protecting yourself. The other thing that I'm also, so my parents who were elderly, they would hate me to say that, but no, they're not elderly. My dad's in his mid 70s. My mom just turned 69, but so they're not elderly. They're just getting up there in years, and they're lovely. But this kind of mask. So this is something that's like a paint mask that can be worn in the hospital. It's got a particulate filter on it, and they're reusable. This is something that could also be worn by people who don't have access to an N95, and they do work quite well. The other thing is facial hair. If you have facial hair, you should shave it. If you can't shave it for religious reasons, or you just don't want to shave it, my dad has actually quite a long beard. As long as you're tucking it up, it will affect your mask fit, but it's something that as long as you're harm reducing and realizing that the beard is not going to be protected is important. So washing your beard when you get home, tucking your mask up and keeping your beard tucked is also nice, and that's also important. But really just making sure that you're as protected as you need to be given your circumstances.
Greetings to citizens of the world. We are so delighted for the opportunity to bring you and your hearts closer and closer to all Earth inhabitants and their habitats. That includes all kinds of beautiful animals, birds, fish, coral reefs, wide landscape, oceans, forests, deserts, and mountains terrains above and underground. Breathtaking beaches, lakes, and rivers, all the outer space, reaching other planets near us like Mars, Venus, and further planets like Kepler and, of course, planet Gliese. We are so honored to join so many artists, musicians, and magicians, indigenous, natives, Westerns, and Easterns, tribal, and villagers. Today, we are live from Pasadena, California, the home, GPL, the Jet Propulsion Laboratory, NASA, Caltech, and the rich artistic culture. Come join us today and live hope. To begin with, we are taking calls and your COVID-19 questions right now. So please call now 310-893-3404. You can also leave a comment that we will show live on our social media. Dr. Theresa Pazionis is live from New York. Theresa C.G. Pazionis, MDMA, FRCSC, is a fellowship-trained orthopedic oncologist and spine surgeon and orthopedic trauma surgeon at Temple University Hospital and Fox Chase Center, Cancer Center in Philadelphia. She is an assistant of professor of orthopedic surgery at Lewis Katz School of Medicine at Temple University, which is currently the epicenter of the COVID-19 crisis in Philadelphia. Hello, Theresa.
Hi, Sarah. Thank you so much for having me on the show. I appreciate it.
You're welcome. We are so excited to have you. So we're going to have questions from our public watching live. First of all, how are you and welcome. How's it going?
I'm doing well. Thank you for asking. How are you doing?
Good. We are excited here, and I wanted to ask you, you are involved, of course, on the front line with patients with COVID-19, people affected by the virus, but tell us a bit more about your work and how it changed since the pandemic started.
Sure. So firstly, I want to thank, so certainly all healthcare providers are on the front lines, but I really do want to thank our emergency physicians, our ICU, and our respirologists, our respiratory therapists, who are truly those people who are getting all of the COVID patients coming into the emergency room on the front lines. So as a surgeon, I mean, certainly I am helping out, I'm doing my part, but I really want to pay props to our emergency service providers as well. Those people are really keeping all of us healthy and really do need to be commended. So how day-to-day life has changed in the hospital? Well, I mean, it's certainly changed quite a lot. I, for example, am no longer doing elective surgeries. So my practice would be spine surgery. If you have back pain or neck pain or sciatica, something like this, or spinal deformity, I would fix that. I see patients as well who have back pain who don't need surgery and who need physical therapy, who need reconditioning and things like this. And we're no longer seeing those patients in person. We're more seeing them through telehealth. What we're still seeing in the hospital is a lot of patients who are coming in with traumas or accidents. We're still doing surgeries for people who need help in that way. So we'll see people who are in car accidents, gunshot wounds. We see a lot of that in Philadelphia. People who have infections, people who have cancer. We're still seeing these patients in person because they need to be seen. They need to be admitted to hospital and treated. The key thing is that each patient who comes in could also potentially have COVID-19, and a lot of them do have diagnosed COVID-19. So the algorithms that we're using for treating people and for isolating people have changed. From a healthcare provider perspective, even walking into the hospital is different. So you'll come into the hospital, you'll get scanned to make sure you haven't got a fever. We'll wear masks for the entirety of the time we're in the hospital. We see patients. Hand hygiene obviously has always been very important in a healthcare setting, but it's even more so important now. Glove wear, personal protective equipment wear has become more frequent. So formerly, patients would see our faces. I've gone through entire days where I haven't seen a patient's face. This has been going on for over a month, and I've operated on many people that have never seen my face, which is never something I would have thought. So I'm coming in and this is what you see, which is far less of a personal experience than talking to your surgeon, getting to know them, feeling reassured. The other thing that's really changed is our patients are no longer able to have their family members at their bedsides. So formerly, if you were involved in a car accident, you would have your mother, father, partner, friend who could be with you in hospital to provide some comfort, to ask some questions, to act as a health advocate, to provide medical history if you're unconscious. And right now, we don't have that availability. So what we're doing is we're helping our patients by providing FaceTime services. FaceTime isn't HIPAA compliant oftentimes, but if a patient does have their cell phone and they want to FaceTime their family members, we are allowing that. It gives a little bit more interaction for our patients and family members than we would otherwise have. We're doing HIPAA compliant phone calls and telemedicine visits with our patients and their families. And we're trying to keep our patients as connected to their support systems as possible, given that they're not able to visit. So we are really practicing medicine in more of a digital age than we had before. There's pluses and minuses to this, but I think it's really changed quite a lot. And it'll be interesting to see what remains changed after COVID has resolved.
And what about you are dealing also with patients affected by COVID-19? What are the precautions that the doctors are taking at the hospital as well?
Right.
Like, how is the situation dealing with those patients?
So at our hospital, what we've really tried to do is we have two wings to our hospital. We have the Boyer wing and we have the main wing. The entirety of the Boyer wing, which used to be the elective surgery wing, has been converted into a COVID floor, essentially. So we try not to cross-contaminate one floor to the other. Essentially, if you are a provider who works in the COVID ward, you'll not then be in the same day redeployed to work in the main hospital. So we're really trying to keep our outpatients who may need to come in because they've broken something to the main emergency room away from the COVID ward, where people will be assessed and treated for COVID. The other thing that's really changed is that if a patient does have COVID and they need to be seen electively, for example, we had somebody who was involved in an accident who happened to also have COVID. It becomes a lot more challenging, where you have to see that patient. Your personal protective levels are higher than you would have normally. Ideally, everyone should have an N95 mask. That being said, because we are trying to ration these, they are in short supply. If you are dealing with COVID patients, you will have one. If you're in regular outpatient clinic for patients who don't have COVID, you won't necessarily have one. If you are dealing with a COVID patient, you'll have to wear one of these at all times. You'll have a face shield, either one that is disposable or one that is like this, that you can bring. This is a welding mask. You can bring something like this in from home and sanitize it. And you'll have a robe and gloves. that you'll wear. It's considered droplet precautions, which means that a spray, for example, if somebody coughs and the droplets or sneezes and the droplets land on you, that's how it's transmitted. It can also be aerosolized. Earlier in the COVID pandemic, it wasn't considered transmissible through aerosolization. We've now shown that actually it is aerosolized and that you can get it through breathing, right? So we're all wearing these masks, and we're also having our patients wear face coverings.
And so you're saying that you are in shortage of N95 masks.
So it's a relative shortage. It's not as bad as it was a while back, but certainly we are, short on masks as far as it goes in terms of not everyone gets one every day. And that's something that is worrisome. The nurses who are the charge nurses on the floor do keep the masks secluded away from everyone else, just so people don't take them home and things like this. Understandable, to protect your family, but we can't have people doing that. And, we really do need them. And it's not just because nurses and doctors don't want to get sick. Well, certainly we don't, because we have families too. And, we don't want to die at work. Their healthcare workers are actually really disproportionately affected by this. There's a lot of theories as to why that is, but maybe repeated viral load. But also because if you come into the hospital and you have COVID and you get sick, that's terrible. We don't want that to happen. We're certainly, our goal is to keep our patients healthy, and that's what we're there for. But if you get sick and then you go home and you isolate yourself, you're unfortunately just going to be sick. And that's a tragedy. That's really bad. We don't want that to happen. So it's not minimizing that. But if a doctor or a nurse gets sick and we don't have this personal protective equipment, we could then hypothetically get every single one of our patients sick who we see that day. And unfortunately, we have had something like that happen. So at Hamilton Health Sciences, so I did my residency at McMaster University in Toronto, in Hamilton, Ontario, Canada. The way it break out there is because somebody got sick, who was a physician, and then didn't know they were sick, were a young and healthy person who was an asymptomatic carrier, and then a lot of patients got sick. So that unfortunately happens when our healthcare providers aren't protected appropriately. So we want to be able to keep caring for you. So we ask that you stay home, physically distance from other people, use hand hygiene, wear face coverings in public, and do everything that you can to keep yourself safe. And also, don't hoard N95 masks. If you have masks like this and you aren't a cancer patient or elderly or a patient with a respiratory status, or really have a good reason why your doctor has told you that you need one of these, they should go to a healthcare facility.
So we want to remind everyone that they can donate by texting the number 1619870 1680 and with message HOPE. So we are helping the doctors and nurses to receive the necessary protective gear, and it's very important for us to hear your experience of what's happening at the hospitals. And can we share what people at home, and when they go out grocery shopping, what kind of mask can they wear and how can they deal with that? Like the type of mask. So we save the N95 for the healthcare workers, right?
Right. So saving those, unless your doctor has told you that you really should have one. If your doctor has advised you to wear one, follow your doctor's advice. This is what I wear at the grocery store. So it's a mask actually that was made by a friend of mine, Edison Cortez, who is actually LA based. He makes these and he sells them. I think Planet Lais is also selling these. Or if I'm going somewhere where I'm going to be in a line, like at a Trader Joe's, I wear something like this, which is, it's not disposable, it's cleanable. And it depends what you're doing really and what your comfort level is. But you should do that. You should wear a mask. You can wear gloves. The key thing is the gloves are not magic antiviral things. The gloves are just meant to protect your hands, right? So what you don't do is wear gloves and eat a sandwich with the glove. Wear the glove and touch your face with the glove. You wear the glove because you, just as one of our really valued callers asked before, if you just can't wash your hands 18 times a day and you're going to be doing one thing, you know, grocery shopping, for example, you can sanitize the gloves and that will protect your hands. So the key thing is that you're making sure that you're being very conscious of both yourself and of everyone else around you, trying not to transmit whatever particles you may have to everyone else by wearing the mask, by washing your hands, not touching your face, and minimizing the amount of time that you're around other people in the grocery store. The other thing that is really key is the physical distance. So staying at least 6 feet away from people. There's all sorts of ways that people can talk about this in a funnier way. So a full llama between yourself and the next guy. Okay, that's one that I really like. At least 2 people between you, okay, and the other person, very important. I just touched my face, don't do that. If you're going out to nature, that's completely valid and completely reasonable. But if you see another hiker on the path, okay, don't do this, do this. Just being very conscious of social distancing and conditioning yourself in a way that you are going to be staying away from people physically. One thing I also really do want to stress at this time is that it's okay to FaceTime your friends and go on Zoom meetings with your friends and things like this. And I actually really encourage that to stay socially connected. But don't do that when you're out. When you're out, you really do need to keep your wits about you, especially if you're in a vehicle. You don't want to be on a phone in any way when you're in a vehicle. And you want to make sure that you're not going to bump into another person by accident, which sometimes can happen. So keep the phone in the pocket. Sanitize the phone when you get home with some alcohol or some bleach or something like this, and carry on as you were, but make sure that you're keeping safe. Once you get home, the one other thing that I want to point out is take your shoes off. Don't bring dirty shoes and dirty clothes into the home, especially if you have pets. Now, I have 2 cats, so my cats like to go everywhere. So what I'm doing is I'm leaving my outside shoes outside my apartment. Certainly not everybody lives, in an apartment. If you live in a house, you may not want to leave your shoes out in the rain. That's understandable. Put them in a box in your home. It can be a cardboard box, can be a plastic box, doesn't really matter, but just keep that as your shoe box so your animals aren't going to be getting into your shoes and then getting into your other stuff, as you work. Okay.
And also, you mentioned social distancing, and we were saying that the word is mainly referring to physical distancing because we want to keep being social and being connected, and the world right now is more connected than ever.
Correct. Well, I think social distancing is the word that we've all chosen and sort of what's been perpetuated by Dr. Fauci, who's doing a phenomenal job. I'm a big fan of Dr. Fauci. But it's not the best word sometimes for us to use. And I think all of us do understand it to mean physical distancing, meaning that, no, you should not go and socialize with your friends in the park. I'm seeing a lot of that. Please, people, stop doing that. Shouldn't do that. Don't socialize with your friends in the park. Don't go over to your friend's house, even if it's just one friend, okay, things like this. But certainly it's very reasonable to call your friends. Go on Zoom meetings with your friends. I've been at one of my friends through a Zoom luau the other day where it was dress up in your finest Hawaiian wear and go and do this. Places of worship are having really great services online. So East End Temple, Joshua Stanton in New York is the rabbi, and he'll have East End Temple services that you can log into if you go onto their Facebook page. So there's really great things that you can do online that keep you connected to your friends, your religious community, your spiritual community. I went to an online yoga class. So there's a lot of things that we can do virtually that do help us stay connected to our friends and our family.
And what are you doing specifically for yourself as a new skill to also learning new skills to lift your spirit, to keep your mood up?
Sure. So I think what I'm trying to do is really transition a lot of my normal activities to virtual activities, as it were. So Milo Sewards, who is my colleague, who's fantastic, he's one of our sports and trauma surgeons at Temple, he started a virtual Peloton challenge. So we're all kind of, socializing that way and also becoming quite active that way by, using indoor bikes and things like this. So I'm transitioning a lot of my outside activities inside. But I've also taken up painting. I used to really like that as a kid, and I let go of it for a while. I just got really busy, but I recently did get into easel. I got some paints, and I've been trying to do some art that I'm going to put up in my home, which is really accessible to a lot of people. It's pretty affordable. You can buy paints anywhere. You can get any kind of quality of paints, but sitting down and painting is actually really relaxing. So really encourage that if anyone wants to give it a try.
And we want to remind also people that you were mentioning before to go out only if it's strictly necessary and not staying out to socialize, and the importance of wearing a mask, but also even if you wear a mask when you're outside, not to stay in proximity to other people because that doesn't protect you 100%.
That is correct. So and again, necessity to go outside is something that's relative. So it is necessary to go to the grocery store to get yourself food. Completely reasonable. It's necessary to go to your necessary doctor's appointments. It's probably not necessary to go because you want to go for the 4th time today to look at this other shampoo. I mean, so a lot of people are saying, well, I'm going to a necessary grocery store run. Well, you've been there 4 times today. Fine. If you want to go outside, I think that's completely valid and completely reasonable, but find areas that are maybe less traveled and more on the secluded end of things. So if you want to go for a walk, that's fine. You should go for a walk. It's necessary for you to get exercise. It may be necessary for you to get out of your house. A lot of people feel very claustrophobic in their homes, and it's actually physically and emotionally necessary for them to leave their home once in a while. That's fine. Don't go to Times Square, although that's really empty right now. You know, maybe take a walk along the West End Highway, or, you know, I went to the Wissahickon Nature Reserve and I took a walk there. You know, there was no one there. That's totally okay. What you don't want to do is go out in a large group, okay? You don't want to socialize with people who you don't share a home with. You don't want to go somewhere where you're going to be at high risk of contracting COVID and then spreading it, right? So all of those things are sort of precautions to take in, but a lot of it is relative risk and trying to minimize that relative risk as much as you can.
What about protecting your eyes when you go out?
So really good question.
Transmitted by, you know, just through eyes?
So there's no evidence for that, but certainly eyes are a mucous membrane. And all of the studies that we've done, nobody said, okay, if we spray COVID into somebody's eye, are they going to get it? Maybe. It's entirely reasonable given it's a mucous membrane, but there's also really not a whole lot of evidence to say that that's going to be the major mode of transmission. I would still try and avoid getting other people's secretions into your eyes. I mean, that's logical. Wearing glasses or wearing sunglasses is something that I think is a good idea, certainly if those are available to you. In the hospital, if you're going to be doing aerosolizing procedures, or if you're around patients who can be doing aerosolizing procedures, I mean, you can wear a face shield like this. That works out quite well. If you're going to wear goggles and you want to, it's not unreasonable. It's certainly something that's completely reasonable to do. But the value added as to whether or not everyone should go out and buy goggles, if that may be a financial constraint for you, it's going to be less value added than wearing a face covering, washing your hands, and things like this.
And what about, you know, cleaning material? Like there are some, everybody is using alcohol and bleach and other material to clean their houses and disinfect them. They can be harmful for their skin, but also to breathe. So what are the best cleaning product to use?
So really anything that is cleaning product that you buy is reasonable. You can have Windex, Lysol, bleach-based things like Clorox, PDI wipes, alcohol wipes, and things like this. Certainly, opening windows and making sure that you have adequate ventilation anytime you're using any cleaning product is important. Reading the labels on the in the bottles to kind of ensure that you're using them properly. Do not mix alcohol and bleach. That will give you chloroform. Don't mix those. It's very, very bad for you. So either use an alcohol-based or a bleach-based. Do not, I repeat, do not mix those together. The other thing that's also very important is making sure you're using hand coverings while you're cleaning and things like this, and washing your hands after, because some of those things can be quite caustic. This is something that has been reiterated multiple times over the past few days, but do not ingest bleach. Do not ingest Lysol. Do not ingest cleaning products. Getting drunk will not help you cure your COVID. Ingesting cleaning products will not help you cure COVID or prevent COVID. Those are poisonous, and those will kill you. Unfortunately, in New York and in Philadelphia, I've had friends who have told me this from the emergency department. Unfortunately, we are seeing people coming in who have ingested Clorox, bleach, Lysol, things like this. Just don't do that. It's not medical advice. It's actually against both medical advice and poison control advice to ingest any of those things, either through inhalation or through oral administration or IV administration. So please do not do that. That will kill you.
And are there any other cleaning material that are dangerous to the lungs?
So any cleaning material that you're taking in through the lungs is dangerous to the lungs. And again, all cleaning materials should be used in a well-ventilated space. Whether or not you should be using a mask while you're cleaning or eye protection while you're cleaning, I've definitely experienced cleaning my oven, my eyes hurt. So sure, it's not a bad idea, but just using your common sense and cleaning as you would normally clean with appropriate protection is reasonable. But you know, most of them are meant to be used by people in their homes without much difficulty.
And what about, so when people go out, what about wearing hoodies or a hat, something to protect themselves? And also, if they don't have a proper mask, what can they do? You were saying something about elastics to protect themselves.
Yeah, so a couple of things. So COVID, also, let's just say you're walking, nobody coughs on your face, but your hair becomes contaminated. Okay, you lie down on your pillow, you roll over. Hypothetically, could you get COVID that way? Possibly, if we're worried about things like cardboard and we look at things like wool and wood and things like this, COVID can last up to 5 days. So yes, theoretically that's possible. So I'm washing my hair every time I go out, and if I come back, I'll wash my hair. When I'm in the hospital, I keep my hair under a scrub cap, both a cloth one and then a disposable one. So it's important to make sure that we're sanitizing all of ourselves in an appropriate manner that's not going to hurt ourselves, but just using appropriate sanitation. Fix the Mask is actually a source that Temple University had sent out to somebody who is a former Apple employee who made this open source technology. So certainly you can share her website. It's available. It's there. It's I believe she also is seeking a copyright for her official technology, but she's shared a trick with 3 elastic bands. So I'll demonstrate it to you guys. So you put your mask on, and the thought is that it creates a seal similar to an N95. I personally haven't tested this, but it is available online. I've tried it personally, and it is a little uncomfortable, but it does work. So you get 3 elastic bands. Okay, these are sort of haphazard elastic bands that I've made. But what you do is you cross them over like this, okay? And then you pull. So you do like a little daisy chain, arts and crafts. This could also be fun for the kids, for the caller who asked about her kids, you know, making little chains like this. And you make 1 loop here, and then you make the second loop here. Okay, so you have like 3 loops on the chain like this, okay? Those go behind your ears, which is, you need big elastics for this. It's somewhat uncomfortable with these sizes, but it is what it is, okay? So we'll go behind your ears. Okay, this is a little short for my ears, and I would probably have to make these a little bit bigger, but the key thing here is that you'll use this to kind of create a cover about your face. It probably works better than this, but these elastics are just something I made out of tape because I didn't have any elastics, but they're a little small. But the key thing is, seal like this around your face is meant to sort of seal the edges of your mask and convert it to an N95-like mask. I think it'll take some finagling to kind of figure out what size elastic bands work for you. You might need a larger elastic centrally, but it's supposed to work quite well. And I think she is also coming out with a prototype that you can purchase that are more face-shaped than this. I've seen a couple of my colleagues successfully wearing this with elastic bands. It seems to work quite well. I'm gonna take this off. Sarah, I actually just had a text question from one of our friends.
Yes.
Okay, this is from Samuel Berg. We love Sam. Hey, Theresa, I was just thinking, and then he puts in quotations, a stupid thought, but why is it not possible to gently vacuum clean the windpipes and lungs like when doing a lipo? So Sam asks this question. I think we should get Sam to log in, but I'll text him back the answer. But essentially, we do have something called bronchoscopy, and it is in a way vacuum cleaning the lungs. It's not like when we do a liposuction. That's a different procedure, but we are able to clear secretions out of the lungs, meaning if somebody has a lot of mucus plugging, okay, so you know when we feel when you feel like that, you feel sick. Sometimes you can also feel like that in your lungs, and that can compromise your ability to breathe. So in some cases in the respiratory ICU, they will do something called a bronchoscopy and a mucus plug removal to suction out the lungs. That being said, that does not cure COVID. That doesn't cure the virus. It may improve someone's ability to breathe properly if it's warranted by a respiratory therapist or an ICU doctor, but it's not something that cures COVID. So I think that's actually a really good question. But won't cure COVID. And certainly that's something that should only be done in a hospital setting or by a trained provider. Should not be done in your home at all, ever.
So I want to thank Dr. Theresa Pazionis. She's a fellowship-trained orthopedic oncologist and spine surgeon and orthopedic trauma surgeon at Temple University Hospital and Fox Chase Cancer Center in Philadelphia. She is an assistant professor of orthopedic surgery at Lewis Katz School of Medicine at Temple University, which is currently the epicenter of the COVID-19 crisis in Philadelphia. Theresa, we really want to thank you for taking the time to be live with us, to answer all the questions from people watching live. And we would love to have you live again for more questions and from more advice and keeping up to date with the situation for the healthcare workers on the front line.
Absolutely. I'm very happy to help out. And certainly if anybody has any questions, I do have an Instagram page that you can follow and ask those questions. Also, should anyone have any questions regarding orthopedic concerns or anything like this, I am available for telehealth visits, which can be conducted in a HIPAA secure atmosphere.
So Theresa, we'll invite you to come back live with us soon.
Absolutely.
So everybody can prepare their questions, they can text them or comment them on our social media. We will make sure that the right information comes out. And we've, of course, helped doctors and nurses to receive the necessary protective gear.
Absolutely. And we all really appreciate that. It's much needed, especially by our nurses and EMTs and emergency room physicians who are working really, really on the front lines. And everyone's quite grateful for all your support and the entire community support and making sure that we all get through this together.
Definitely. So you are officially invited again to be live with us.
Absolutely.
I want to thank you for the time and all the explanation. Everything was very clear. We also send you all our support, and we hope you're safe. And we thank you so much for all the hard work you're doing to keep all of us safe.
Thank you so much. And thank you as well for everything that you do.
You're welcome. We will see you soon live here.
See you soon.
Bye.
Bye.
Take care. So I want to thank everybody for watching. We will be live soon again with Dr. Theresa and also other artists and musicians from all around the globe, because we're here to celebrate Earth Day and to connect the world in a positive way. Thank you so much for watching.